And still on health, counties have been urged to replicate and improve on what Makueni County has achieved in the health sector in order to achieve universal healthcare coverage. During a discussion to see the gains made so far, stakeholders from the health sector raised concerns over the threat of graft and industrial action that has dogged the sector. Lack of misuse and underuse of medical equipment in health facilities also came to the fore during the Nation Leadership Forum.
In 2016, Governor Kivutha Kibwana rolled out an ambitious plan that would ensure Makueni's senior citizens benefit from free medical care. With just 500 shillings annually per household, one can gain access to medical care without any more pressure.
And we started with a pilot for 65 and above from May to September 2016, and it was working. And then we graduated everybody so that today, those who are 65 and above don't pay, but everybody else pays 500 shillings, and we have about 70% coverage.
This is not only the health facility, it's also the health workers, very importantly, to have, when you come to the health facility, somebody there that's qualified, that is knowledgeable, that is able to treat you. You have the right equipment there, and you have the means to refer these people to other facilities, to higher facilities, if necessary.
As Makueni continues on this journey, the rest of Kenya hopes that by 2022, 35 million Kenyans will be under the Universal Healthcare Coverage Plan. To enable this, Treasury has already allocated 69 billion shillings in the 2018-2019 budget.
And I think for now we are saying we need to recruit people into NHIF. When you talk about how we can pay for healthcare, there are many forms of paying for healthcare. The government even now is purchasing healthcare for the people. We're doing Linda Mama, we have user fees that were removed at the facility. The question is about what are we paying for? I think that's what has not been defined. And if you remember the old story of Alice in Wonderland, it doesn't matter where you're going if you don't know what the destination is, which route you use. So we have to define what is it we want to purchase. And I think that's where NHIF is still struggling. NHIF has their own packages. They have packages that they have designed themselves, and that's what they're providing.
According to key sector players, there are challenges they believe might hinder the success of the project. While modern equipment has been installed in many health facilities, many lie idle as Kenyans travel far to access treatment they could otherwise receive closer home.
Is that most of this equipment is actually functioning because of the manner in which this equipment were acquired. There is service provision linked to it, there is training linked to it by the providers, and they are providing that as far as we know. There may be a few isolated cases of equipment probably not being installed in certain places for lack of either power or proper water and all of that. And I think those are isolated cases. But in general, that investment is paying off, and I think it will be a matter of time before we see the dividends from that.
We acquired this equipment and immediately started paying for it. But it took many counties 3-4 years to get them operational. In that time, they've been paying for a service they're not using, and 7 years the contract expires and this equipment goes away, but the Mwananchi has really not seen value for taxpayers' money.
For the healthcare to get to this patient, health professionals need to be available. In the last few years, the sector has been hit by industrial unrest. KMPDU championed for better working conditions of personnel and better pay, but is now battling a new challenge of foreign personnel coming in to fill the sector.
I can guarantee you we produce quality products. Our doctors are good and able, and we just need to put resources in place so that they are able to work, and also so that we don't get this brain drain to the private sector, to more lucrative areas, to other countries, because I think Kenya is blessed in that aspect.
The Nation Leadership Forum sought to take the discussion forward on better ways to deal with the challenges, among them the ghost that continues to bedevil the country. Industry players say that UHC also needs to focus on preventive healthcare and not just the curative medicine. Leila Mohammed, NTV.
Can we address the universal health corruption issues? 5.2 billion missing from Ministry of Health.
I want to say that universal health coverage or delivering health to our fellow Kenyans, affordable quality health care, is a business of each and every one of us. And I think it does not serve us taking adversarial positions against each other because we are working for one common cause.
Leila Mohammed, NTV.